Welcome, Rotarians. We have Sam Lupica is our invocator. Sam?
Well, who just loves modern day meetings nowadays? This is just, can't get any better than this. So, all right. So today was going to talk about four-way test, interestingly. So we all say this every week without any idea, I think, of the historical side of it. At least I do anyhow. So, so the historical side of this, interestingly enough, this was started by Herbert Taylor, not for Rotary. And he was a director at a company called Club Aluminum Products that was going bankrupt. And his first job was to set policies for the company that would reflect the high ethics and morals God would want in any business. And after sitting down, literally praying about it for a second, he wrote down the following 24 words. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Fast forward about 10, 15 years later, and he was in charge of Rotary International and offered the four-way test up to Rotary, and Rotary said, yes, we'd love it. And that is where we ended up with the four-way test. I thought it was a really interesting story. So with that, I just want to open us in prayer. Dear God, we thank you for the little things in our lives of just some random person who was just trying to keep his business afloat, which he did, and his ability to listen to your word and give us something as meaningful as the four-way test. Lord, right now, I just thank you for all of those that were able to attend today. Lord, I pray you would bless their businesses, bless their personal relationships, and bless this time. In your name, amen.
Amen.
Thank you, Sam. And now please join me in the Pledge of Allegiance. I pledge allegiance,
Pledge allegiance to the
to the
flag,
flag
the
of the
United
States of America,
and to the
to the
republic
republic
for which
for
it
which it
stands,
stands,
one nation,
nation,
under
under
God,
God,
indivisible,
with liberty,
with liberty and justice for all.
justice
for all.
for all.
The four-way test, as Sam just told us the history of. Thank you, Sam. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? Well, thank you, everybody. I think we have a fair number of guests today. Lorraine Javassi is a relatively new member who has stepped up to introduce our guests. We will introduce Aimee Wade when she's about to speak. So go ahead, Lorraine, have you spotted guests?
Well, to be honest, like you said, Dr. Rob, I am fairly new, so there are some newer faces on here, but I'm not sure if they are members just because I haven't seen them before. So if you do have a guest, I see Josh Lyons, he's a guest today. I have a nice helper with me as I'm going through this, but if anybody has any guests that they would like to welcome, feel free to do so. Yes, June.
Yes, thanks, Lorraine. Hi, everybody. My guest today is Dr. Radha Bodapati. And Dr. Bodapati has been the executive director of the nonprofit GAHSS in Akron for the past year or so. And GAHSS stands for Greater Akron Hindu Seva Samiti, which means Service Committee. You might remember that our club last year had the opportunity to do a fabric drive for COVID mask making, and GAHSS was the recipient of that fabric. So they used the fabric to make masks that helped support seamstresses from the Nepali and Bhutanese community in North Hill. And Radha has been a terrific advocate for this particular immigrant community in Northeast Ohio, and we've really been privileged to get to know her through that process. And just Radha, we're so glad to have you. Would you like to say a quick hello?
She may be muted.
Really looking forward to listen more today and get to know about Rotary International and the initiatives that all of you are involved in. Thank you.
Thanks, Rada. Welcome. Malcolm Costa has a guest here too, Lorraine.
Yes, it does look like that. Aimee Budnick, you're a guest today. Would you like to introduce yourself and say a little bit about?
Hi, good afternoon. I have the privilege of working at Community Action Akron Summit. We oversee a project that works with infant mortality and chronic disease using community health workers. And we also are a contracted partner for the Addiction Helpline. Thank you.
Awesome. Thank you for being here. And then we have Jacqueline Palumbo. I'm sorry if I pronounced your last name incorrectly. Would you like to take a moment to introduce yourself and tell us about yourself?
Sure. Hi, everybody. Good afternoon. I'm Jacqueline Palumbo. I'm a guest of Mark Seward today. I'm an elder law and estate planning attorney practicing with my law partner, Alan Sweet in Fairlawn, Ohio. So we can serve nursing home costs for families as well as do estate plans. So thanks for having me today.
Thank you for being here. And then we have Josh Lyons. Would you like to take a moment to introduce yourself? I think you're on mute.
Yeah. Hi. My name's Josh Lyons. President-elect and serving as president for our Akron Rotary Club. So just sitting in and yeah, I'm an account manager with a national land services firm. We do all the surveys and zoning compliance reports.
Wonderful. Thank you for being here today. Does anybody else have any guests at all? Is that it?
Ryan is technically a guest until we bring him in,
Okay.
and so is Jerry.
Oh, wonderful. Thank you.
So thank you, Lorraine.
Thank you.
Are there any Rotary ambassadors? Anybody who's attended another club or a function? Sandy, did I see your hand up?
Yes, last night I attended the monthly district grant committee meeting. And so we were finalizing grants for this past Rotary year and gearing up for the new Rotary district grant year.
All right, thanks, Sandy. Who else was a guest somewhere? Jack.
I attended the Barberton Rotary Club meeting last week. They had 13 members and they're gearing up to some projects and some partnerships with the Barberton Community Foundation. And it proved to be one of the benefits of Rotary and networking. Not been able to get an appointment for her COVID shot yet. And I was alerted that through the Barberton courts, they were watching and lining up things, and she has her appointment for the 4th. So Rotary paid off again.
Good job. I was a ambassador. I attended, thanks to Jack, I attended the last Wednesday evening's Indianapolis Club, where I got to hear energetic Jenny Stotts, who many of you have probably heard in other forums, talking about resiliency. And she did talk about the 4-way test and how Rotarians are often kind, but she gave a take-home message that perhaps in addition to saying kind things, we should listen with kindness. And I thought that was a pretty good take-home message. And I've been trying to incorporate that into my daily routine, so I don't get defensive or start to say but, and I just listen with kindness, and certainly makes my life a little easier. We do have the opportunity to attend the Rotaract tonight. Cheryl sent that out to all of us. Josh has done a great job with his team getting the Rotaract moving again here in Akron. And if you can attend his meeting, please look for the link that Cheryl sent. And other announcements, I will remind you that last week in the Acrotarian, Chef Rosh's recipe, that's her own brand of Indian cooking, that has a stuffed kebab that is in the chat. It was in the Acrotarian, and actually the McGregors are going to make that next week. Speaking of next week, please come prepared to join an action group, because we are getting together about our strategic plan. All the good work you all did in our small groups will be discussed. The facilitators and those who scribed will also be at the meeting to be able to correct McGregor if he used too much poetic license. And then we look forward to actually turning that into action items. There were 2 quick wins from most all the groups, and would like to see those get moving. There's several other meetings. May 15th is leadership, and that's a Saturday, correct, Cheryl? And that's for anybody that's, all Rotarians are leaders. So it's for all of us, but specifically if you have an office coming up, that would be especially good for you. And then April 22nd through 24th is the district conference. And I think our highlighted day is the 22nd. So please be on the lookout for that and make a note of it. One of the things as we've been weathering this pandemic, and I heard Jack say he's got COVID fatigue, and I've heard lots of members say, wow, this is getting old. In an effort to try to change things up for those of you who are new, we often have an icebreaker. And today I'll share that I got a new smart TV ostensibly for my exercise room, but I've discovered some opportunities to binge watch, and I'm embarrassed because I'm not a TV guy other than sports. So I will confess that my binge watch is Schitt's Creek. I don't know if you've seen that. So today's icebreaker is, what is your secret binge during this pandemic? And Hugh, why don't you start us off, Hugh? You're muted, Hugh. There you go.
I love The Crown. We watch that every night. We are now watching Ozark. So those are the 2. I love The Crown.
Well, that's great. I'm making notes because I'm a novice at smart TV. All right, Lorraine, why don't you tell us? You're front and center of my screen.
I've been watching Cobra Kai.
Oh.
From the Karate
Phil
Kid.
Williams likes that. Phil's another fan.
I don't watch a lot, but I've gotten kind of sucked into that.
All right. How about you, Steve? Steve Bossart?
Ozark, the best show on Netflix by far. And I'm sitting here realizing I watch too much TV. And Friday Night Lights, maybe the best show ever on television.
All right, Julie Brandel. Steve's making it tough for you to follow.
We don't watch a lot of TV. Trying to think what. I'm really into the cheesy Hallmark movies lately. No. Well, yeah, kind of, but it's mindless movies, mindless television. But I was trying to think about, it's coming back May 8th. It's called Dead to Me on Netflix. I don't know if you've seen it, but it's really kind of dark humor, but it's a good one. So it'll be I think this will be the 3rd and last season. So if you haven't seen it yet, 1 and 2 are on Netflix. It's pretty funny.
Dead to Me. I saw Rada, our guest, she raised her hand. She's seen that.
Yes, I've seen that.
And Katie Miller is shaking her head emphatically. So Katie, what else is in your secret?
I love that one, and it does fit Julie Brandel's sense of humor, as a little bit of dark, twisted comedy. And I say that with all the love in the world. Casey and I just got done finished binge watching The Good Place, which was on NBC, but I never watched it. And it is super quirky about the good place and the bad place in the afterlife. And our other favorite show we like to watch is called Somebody Feed Phil. As executive producer Phil Rosenthal from Everybody Loves Raymond travels the world and eats, but he's a real goofball about it. And every episode he calls his elderly parents back in New York and they joke around. It's just very wholesome, delicious fun.
All right, Doug, Dr. Doug, do you have a secret that you want to confess about your binge?
For our younger members, we're doing something called DVD. And I bought a set of The Vicar of Dibley, a British comedy. So we plowed through most of those.
And you have a DVD player that works. Good for you.
We also
Josh-
have VHS
Josh-
for the really old folks.
So Josh, we'll have to have Dr. Doug teach you about DVDs at your Rotaract.
Yeah, I'm excited.
Sam Lapika, what are you binging?
Binge watch much. I don't watch much TV, but my girls are into Heartland, Casey Undercover, Pioneer Woman. It's the other thing they've had on this week. There was something else. Oh, Sulphur Springs. Disney has some new Sulphur Springs thing that my younger one thinks is. She was really upset this morning because she's watched all of them and she's caught up. So.
All right. Well, we will. Chris Richardson, since it's good to see you back, do you have a TV issue?
I do. So I watch a show called Longmire. So I don't know if anybody's watched it, but it's taking place in Wyoming, and this guy's kind of like a dirty, hairy kind of cop, and he's solving problems of the town. So pretty good show.
All right. Well, thanks everybody for sharing, indulging me in these icebreakers, but it's a way for us to at least have some added human connection. And I came up with another ad because for Happy Dollars, that's usually an oral take, but you are welcome moving forward that if you can get a photo of what makes you happy for Happy Dollars on the Monday by noon, we'll be able to highlight one of your happiness, and it'll give us another vision of what's going on behind the scenes. Cheryl, do you want to show my debut Happy Dollars? This is my grandson, Caleb CJ. As I shared last week I have 10 more Happy Dollars. My daughter's daycare, she's just back from maternity leave. They had to close because of COVID, and I was the only vaccinated eligible babysitter. So I took 2 days off and hung out with Caleb. So that was really a happy 2 days. Who else is happy?
He has your hair, Rob.
He has my hair. That's what my son-in-law says too. Only a few perfect heads are allowed to be exposed. Anybody else happy? Let me flip the screens here. June, you're happy.
Yes, I'm happy. Our eldest daughter got engaged a few weeks ago, and we're so excited. Just a wonderful guy that she's going to marry this August, and we got to meet the future in-laws this past weekend. So very happy about that. I'll do 5 Happy Dollars for that. And then I have 5 more Happy Dollars. I just wanted to remind everyone that our Lala's in the Lakes, which is the restaurant on the Chili Open raffle ticket, expires April 1st. So we have this month to get over to Lala's. They have wonderful food. It's great takeout. They're right on Manchester Road, very near the camp. So hope everybody can take advantage of that.
All right. Thank you, June. Anybody else happy? David Hall's happy.
Yeah, Dr. Rob, I'm happy. I'm $5 happy, and just wanted to say thank you to a number of people who have stepped up and signed up to be invocator and greeter. And Sam Lapika stepped in for me today, so a big thank you to him. I know Katie Miller is stepping outside her comfort zone and is going to do some invocations, as well as Lorena, who did our greeting today for the first time ever. So she did a fantastic job. I'm going to try and reach out to some of the new members and just walk them through how easy it is to do. But if you have interest beforehand and want to reach out to me, I'd be happy to help you get signed up and tell you how easy it is to do both. So that's my 5 Happy Dollars.
Great job, David. Thank you. And I do encourage those of you who in the strategic plan said you want to be voluntold. Why don't you let Mr. Hall volunteer you for an opportunity? Anybody else happy? Julie's happy. She's always happy.
Hey guys, I just wanted to remind you about the storytelling opportunity for the Akron Public Schools. Because their children don't always have the opportunity to hear live stories, we're going semi-live by adding to their digital library at the Akron Public Schools. I've sent you an email a long time ago, but I know that Gina Campbell took part in that, and also Lorraine took part in that. So it was a fun opportunity to read their favorite stories, and then they are to live in infamy in the library for the Akron Public Schools reading their books. So if you have any interest and you didn't remember seeing the email, reach out to me, please, and I'll make the connection, and maybe you'll find a book that you'd like to read to any age group. And parents then can log on and have their kids there to listen in. So thanks so much to those who've already done it, and I'd love to see some more people get involved.
Excellent, Julie. There's a message in the chat. Could you resend that link or maybe post it in the chat or give it to Cheryl for the newsletter?
Or both.
Or all of the above. Okay, Lorraine, I see your hand up.
Yes, I have 10 happy dollars today. My 16-year-old, she's a sophomore at Manchester High School. She made it to the varsity softball team, so we're really proud of her, and they're going to have a season this year, it looks like, so that's exciting. And then for my 8th grader, going to be 9th grader, she got recommended for accelerated biology, which is a big deal for her. My older daughter always has been in high like honors classes, and she hasn't. So this was a really big deal that she was able to get into a high class like her sister, and it's biology. So that was really big. So I got $10 because I'm pretty proud of them.
That's awesome. And Cheryl.
Yes. Well, you can see I'm wearing my crown today. So for those of you who don't know the purpose of this crown, it was given to me by Katie Miller. So Katie and I have come up with a new program that has been approved by Dr. Rob and by Steve Bowie. Moving forward, we're going to try this. Katie and I are going to get together and we are going to pick the next recipient for the crown. And yes, I have watched the whole series of The Crown as well as Schitt's Creek. So there'll be a process that we'll outline in the newsletter, so watch for it. You never know who will be the next lucky recipient to wear it for a month or two. We're deciding the time frame. And yes, men will have one too. It is not gender specific, boys. So look out, you may be wearing the crown soon.
But
I'm giving 20 happy dollars for that announcement.
But we're going to get a male crown too, because I don't expect the men to look like Miss America. So we'll have a queen crown and a king crown.
Yeah, I don't like the tiara because it messes up my hair.
It would probably just hurt because it's got pointy cones on it, Rob.
All right, well, David Hall mentioned new members, and it's
Malcolm had it.
Oops, did I miss somebody?
Malcolm had his hand up.
Oh, I'm sorry, Malcolm, I missed you.
Good afternoon. Yeah, I'd like to contribute 30 happy dollars, $10 for seeing Virginia Wino, $10 for the induction of for our new inductee, which my friend and my sister's best buddy, and $10 for Chris Richardson's new position. Thank you.
Great, thank you, Malcolm, and congratulations, Chris, on your new position.
Thank you.
Okay, well, we are going to move to new members, and it is phenomenal. This crowd, Tom Knauer and his team have continued to build on our wonderful membership despite the fact that we are virtual. And today we have two members to induct. So Jerry Kiefer will be with her mother.
Hi.
Ginny Wino is her inductor or her sponsor. And then we have Ryan McCauley. And Ryan is actually Dan O'Connell's was his sponsor. So fellow Rotarians and honored guests. On behalf of the Rotary Club of Akron, it's my privilege to induct two new members today. Please allow me to introduce candidates for membership. Jerry Kiefer and Ryan McCauley. And I said already, they're proposed by Ginny and Dan. Ryan and Jerry, you're beginning a great adventure in leadership, friendship, and service to your community with your invitation to membership. The Rotary Club of Akron has accepted you as people of good character with high ethical standards people who have hearts for service, and people who will represent the classification of community leader. We have invited you to become part of this worldwide organization dedicated to encouraging and fostering the idea of service above self. If we were in person, Jenny and Dan would now present our candidates with their official Rotary name badges, which we will hopefully get to do sometime in the near future. But it features the Rotary wheel, which is the international symbol of Rotary. And I encourage you to wear it regularly. Show your wheel. You've been invited to join Rotary, but it'll be through your own actions that you truly become Rotarians. We encourage you to learn all you can about Rotary and to strengthen your own leadership and communication skills by actively participating in the activities of this club, including attending weekly meetings, social events, service projects when we can have those in person, and also invocate and greet. You'll be provided many opportunities through this club and district to enhance and expand your professional and personal skills, and these opportunities hopefully will give you great value. You will also be provided with opportunities to provide service to others through club service, vocational service, community service like reading to the library, and international service. I invite you, fellow Rotarians, to give of your time to make Jerry and Ryan feel welcome and provide them with guidance and friendship. Fellow Rotarians, please help me welcome Jerry and Ryan, our club's and the world's newest Rotarians. Now we'd like, Jerry, would you say a few words, introduce yourself? And I know you're not a new Rotarian, you're just new to us.
Well, right. I hope you can hear me. I've unmuted.
We can.
Well, I was a member of the Frederick County Rotary Club and the Winchester Rotary Club. And I am a Paul Harris +5. And I have a little ironic story to tell about my car. It just conked out. It's gone. And I had already ordered and gone into the whole Ohio title of registration process, a rotary plate with Dr. Kiefer on it. But I am glad to announce that I can transfer it to the car that I have to buy to replace the dead one that's in my garage.
It's a rotary plate.
It is a rotary plate. So I am very excited to be a member of this club. I'm happy to be an Ohioan and Akronite after being an Akronite from birth. And I'm delighted to be with my mom, whom I love so very much.
And we thank Malcolm because Nasa, his sister, and Jerry were best friends.
Yes. It's really cool being back.
Well, welcome. We're happy to have you. Ryan, would you be willing to say a few words about yourself?
So I was born and raised in the Akron area, lived in Stowe, Ohio my whole life. Went to Western Reserve Academy in Hudson, graduated from Kent State, and about 7 years ago moved out to Phoenix. Had an opportunity with Bank of America, and actually met my wife at Bank of America, worked there for about 7 years, and just moved back to the Akron area about 6 or 7 months ago with my wife and our 1-year-old son. We just bought a house actually just right around the corner from the camp down in New Franklin. Work for McCauley Financial, which work with my father, brother, and brother-in-law in Fairlawn, and really excited to work with you all and meet you all in person eventually. My father and brother are both past presidents of the Hudson Rotary Club, so I've pretty much been adjacent to Rotary my whole life, and finally just getting around to getting involved myself.
Well, welcome, and it's time. We'll get you in that slate to get real active real quick. Thanks. Okay, now I'd like to introduce Aimee Wade. She is Summit County's alcohol, drug addiction, and mental health services interim executive director. And boy, what a time to be in that role during the COVID pandemic, because I understand all three of those challenges are bigger than ever. So Aimee, I'm going to mute my mic and let you take it over.
Good afternoon, everyone. Thank you for having me this afternoon. I was very elated to hear your discussion and conversations. I didn't know if I was allowed to join in as a non-member at this point, but I have to say my guilty pleasure has been Bridgerton. So that's the show that I've been watching on Netflix. So I definitely wanted to throw that in there. So great conversation. Just to share a little bit about myself with you guys before I go into the agency. I am just a kid from Akron. I found and born and raised in the Akron area, a product of Akron Public Schools, graduate of Kenmore High School before going off to college for 4 years and coming back to the Akron area and continuing my higher education and my career here in the community. I currently live in Barberton, Ohio, and I've been there for 16 years with my husband, and we have 2 adult children and 1 grandchild who will be 1 year old on the 21st of this month. So that's my happy story. So with that being said, I want to tell you more about the work of the Alcohol, Drug Addiction, and Mental Health Services Board. I saw you guys had my recent appointment letter or my recent appointment information on your website. It's been a whole 3.5 weeks since my appointment as the interim executive director here at the Adm Board. But I've been with the agency for 10 years, and it's been a wonderful journey, and I'm just honored and privileged to be trusted to be put into this position to guide these services for our community. So let me share my screen here and tell you more about ADM. See if I can get this right.
We got it.
Got it? Great.
You may want to put it on presentation mode.
Presentation, something changed since the last time we just did this. Let me try this one more. We practiced and it worked just fine earlier.
I saw it. I vouch for you.
Let me try here.
I think you just started your presentation and it worked.
Okay, let me start it again and see if that works. How's that showing up for you all?
Yeah, you want to run your slide. There you go.
You got it.
All right, perfect. Oh, technology. So just starting off with a little bit about the ADM board. We are one of 50 county boards across the state that are responsible for overseeing effective treatment, prevention, and recovery services for our county constituents. I can tell you during this COVID pandemic, the first statement on this slide that alcohol, drug addiction, and mental illness are real medical conditions that can affect anyone is something that has been at the forefront and something that we've had to advocate for continuously. ADM board services and providers have been open through this pandemic. We've been promoting that we're open. We've been advocating for getting resources and access to PPE for our folks that continue to be in the field and continue to serve those that are truly vulnerable in this environment. So I just want to nail home that these afflictions are real medical conditions that anyone can be affected by. And our motto is that recovery is possible. Treatment works and recovery is possible for anyone. So our services are always presented with those in mind. As I mentioned, we're one of 50 boards across the state, and we look to fund services to make sure they are available across the lifespan. So that's from youth to older adults, and even prior to birth in utero. We have maternal depression programming that we offer for parents to make sure that, you know, during pregnancy, even after pregnancy, that, you know, there are some wellness components that are put in place, because we know those are critical times for mothers, parents, and the children that are involved. We contract with over 30 local organizations to provide state-of-the-art services, and most of our services are funded through our local property tax levy. So that provides a great opportunity for us to fund non-traditional services. We do fund some services that are traditionally covered by Medicaid and other insurers, such as treatment services, assessments, group counseling, family counseling, individual counseling, and things of that nature. But what our tax levy allows us to do is to really be able to fund those supportive services that are not traditionally funded by insurances and our supplemental services that help to make sure that treatment and the things that are given are supported by the basic human necessities to help people stay in recovery. So this slide just gives a breakdown of how our board is funded, and you can see that the majority of our funds here in Summit County are through the tax levy, and we're so appreciative of our county constituents to see the importance and the need for the mental health and addiction services that are provided with these dollars. But we do receive some small funds from state and federal grants as well. And this is just a representation of our expenditure of those dollars that you saw that we bring into the Adm Board. And 94% of those funds that you saw, that over $42 million, goes right back into the community for services and contracts. And we have a 6% overhead. We employ about 21 staff here at the Adm Board. They're a strong, committed bunch that are committed to working and making sure that these funds and the planning and evaluation and monitoring of the programs that we fund out in the community are effective and efficient for Summit County residents. So I just wanted to share with you guys some of the data that we use to inform our funding. And some of the things we've been paying extra attention to, especially during the COVID pandemic, during some of the uprising and racial injustices and some of the political climate, has all had an impact on our community and the mental health of those who are witnessing and experiencing this. We can't seem to get away from it. It's in the media. If you're not physically there, you know, you're there through the internet, you're there through television, and we're just trying to monitor and measure the well-being of Summit County residents to make sure we're being responsive based on the data that we're collecting. So one of the things that we monitor here in Summit County are the death by suicides. And it's a grim subject matter to be talking about, but it really helps you get a handle on how folks are coping and dealing with the things in our environment. And it helps us determine how we're responsive. As you can see here, the rates per 100,000, this is for Summit County, and what we've seen over the past 6 years in regards to death by suicide. I can tell you that while it's been relatively steady, in 2018, we did see a rise in youth suicides. And in 2019, in the fall of 2019, there was a rise in older males, and older male suicide, and specifically African-American males. So what we do with data like this is we start to target our activities. We work through our Suicide Prevention Coalition to make sure there are resources pushed out into the communities, looking at all types of demographics, whether it's race, age, gender, zip code, to find out where is this occurring? Who is this occurring with? Is there any way we can get an idea of what is precipitating this and put resources into the community to let people know that there's help, there's hope, and where to find that within our system? This particular slide demonstrates some data that we collected in collaboration with Summit County Public Health and Case Western Reserve University. We had the benefit of implementing a youth risk behavior survey starting in 2013. We do that survey every 5 years, and we did it again in 2018. And we use these as benchmarks to monitor how we're doing with the implementation of our services. And again, where to direct services and funding. We had about over 30,000 middle school and high school students respond to this survey each time that we did it. So it's a wealth of information. It's a wealth of information that we share and we put out in public. It's actually on our website and Summit County Public Health's website, if that's something that anyone ever wanted to look at or use, because we don't want to be hoarders of the data. Any way it can be helpful to our partners and using that data to get grants And to direct those services, we definitely want to make that available. But one of the data points you'll see here is depressive symptoms, and this is within our high school students. And it looked at our 2013 versus our 2018. So mind you, this is even before COVID. This is before, the isolation and some of the stressors that came along with that. And you can see the slight increases. And we broke it down by Akron, suburbs, and then county-wide. And across that spectrum, you can see that there were increases reported by our middle schoolers in regards to reporting depressive symptoms. Here's some of the data we collected for our high school students, and this is in regards to some mental health variables. There were a variety of questions, and this was broken down by gender. And again, when you think about how we direct our services, who we target, where we target services, you'll see here that by and far, our female high school students had higher reporting of self-injurious behaviors, of feeling hopeless, seriously considering suicide. I mean, this is problematic data that, as I talk a little bit later, you'll see, we've implemented some very specific activities and initiatives to address this. And again, point out, this is all pre-COVID, pre-everything we've gone through over the past year or so. So these are things that we're really paying close attention to and talking with our partners and gathering other data points from across the community to make sure we're able to have some type of impact to curb what we've been seeing in the patterns and trends of data that we have. And I promise I'm gonna get away from all the grim data here really soon. Unfortunately, this is part of our day-to-day life to kind of monitor how we're doing. But this is just an example of how we monitor in terms of the substance use in our community. And this is the overdose data that we monitor broken down by substance. So we can actually see what substances are being used in our community, what's more prevalent. And this particular chart is broken down by year. So you can see what was prevalent in Summit County in 2019 versus 2020. And that really impacts our marketing, our service direction, our targeting of certain communities in regards to how we know what's on the street, what's effective treatment services for those particular substances as well. And then this chart just kind of monitors our work in Summit County in comparison to other counties. So that's counties that are approximate or are neighbors in Summit County, and counties that are similar in size like Lucas County and Montgomery County. On this particular chart, you will see Summit County here is the black line on the chart, and where we fall in respect to our neighbor Stark County, who's smaller than us. But you see here in Lucas County, which is the Toledo area, and then Montgomery County, which is the Dayton area, which have some similar sizes to Summit County, and kind of how we fare in regards to the addiction and overdose rates. Now, as we monitor how we look to address those things, some of what we look at is access to our system. We really want to make sure that when folks are ready to get help and they're seeking that help is available and they have somewhere to call. So you heard earlier from one of your visitors, Aimee Butnick, working with the Akron Summit Community Action. They actually run our addiction helpline. And that is a resource that they run and help to monitor how soon folks can get into services for addiction services within our system and across our providers. So you can see versus male versus female, kind of the wait time to get from the call to the helpline to when they can get in the door for an appointment with one of our providers. And we're always working to make that number lower. And things that impact that number is sometimes, folks aren't available right then, but in a lot of cases, I think the mean is most folks can get in within the same day or within a day. There's an appointment available somewhere that they can go. But for various reasons, folks may not have transportation at that time, and, trying to work with those different factors. But by and large, less than a week, folks can get in when they want some support and help. Looking at our detox services, you can see back in 2016, that was the height of the opiate epidemic. And that number really, it went up and it spiked as far as how quickly people could get access to that immediate crisis services. And we quickly went into work to fund additional beds and additional access to that particular service. Right around that time, Orienta House runs that program for us. And since then, overdoses have decreased overall. However, you can walk right into that service with no wait if you're eligible for that service based on your diagnosis right now. And then again, another access point is for our residential treatment services, and that's working with agencies that you guys have probably heard of, community or CHC Addiction Services and IBH Recovery Center are our two primary residential treatment providers. And again, you can see how those numbers and our collaboration and coordination with those agencies and investment of resources really got us down to a reasonable amount of time. If someone is assessed to be in need of residential treatment services, as of the last quarter of 2020, within 5 days, people were able to enter that level of care of treatment service. So again, those are just some of the barometers of how we monitor what's going on in the community and how we monitor our ability to deal with that and our capacity to be able to deal with the need of our residents and being able to get access to those services. So just to highlight some of the initiatives that we've been involved in, especially, like I said, through some of the struggles that we've been going through as a society, as a world really, but focusing here on Summit County, is our collaboration with Asia Inc. to develop communication and education resources around mental health for diverse populations that they serve. And we've really been excited to embark on this effort. We historically funded prevention services with Asia Inc. to work with the populations that they do, but we really lean on our experts and our cultural brokers within the communities to be able to help us direct those services and make sure our communications and services are culturally relevant and appropriate and available to all Summit County residents. Another highlighted program is our collaboration with our Change Direction Faith Committee. So that committee has been really targeted and working with our local faith partners. And this particular grief recovery method project is targeting our African-American churches in the community. With the spike of violence in the Summit County area, there was really a need to address grief around some of the deaths that have occurred, the deaths around COVID. There was just really a recognition that there needed to be some additional support. So they have trained approximately 15 faith leaders across Summit County to be able to train others and provide this method for those who are struggling with grief, to be able to identify that grief and appropriately process that grief and give folks hope and hopefully building some resiliency in our community. Another initiative was through our Suicide Prevention Coalition. I show you that data where we saw some spikes and some anomalies in the data that we were collecting, that we actually get that data in real time through our medical examiner's office. So we're able to respond in real time, and we were able to partner with some of our local pharmacies, some of our local takeout, fast food restaurants. We put out thousands of flyers of information on pizza boxes with some of our local pizza shops, and working with the Akron Canton Regional Food Bank to really get information out so people know where to go. I found a lot of times when people are in need, you don't know where to go if it's not something you've traditionally used. It's not something that's at the forefront of your mind. So as much as we can get the information out there and say, hey, we're here, we're open whenever you need us, and trying to be present and visible in the community, that's been our goal. And again, these were some targeted outreaches based on some of the demographic data we were collecting over the course of the past year or so. In order to be able to keep our providers open, their doors open, and support the staff to stay there and do the work and be able to adjust to a telehealth model or in-person services when they were needed, we actually grant funded our providers for 3 quarters of last year versus a fee for service model where we paid for each service that they provided. They were forwarded that money to make sure their doors could stay open. We know volume was down, but we know that the services were needed. We're kind of bracing for and on the precipice of the pandemic, after the pandemic, as everyone starts to emerge on the other side of this, and they're trying to cope and deal with readjusting. We want to make sure our system is stabilized and available to meet those needs when they reach the forefront. Another service we partnered with Minority Behavioral Health Group on is there was a FEMA crisis grant. So anytime there's a disaster, FEMA pushes out money, and the pandemic was considered a disaster. And so we partnered with Minority Behavioral Health Group to employ some staff and do outreach into community to engage and talk about COVID, help spread the facts about COVID, help reduce the stigma around COVID. Some of the things they revealed were, folks were scared to even talk about having COVID due to the stigma, and they were being shunned because they had COVID. So there were some things that were illuminated, and they were able to reach out and help, break some of the isolation, engage some folks who weren't normally engaged, and then ultimately talk about the vaccine and help spread facts about the vaccine and information and access to the vaccine. And then in the midst of all that, one of the things that I'm even most proud of is our continued work with Akron Public Schools and their college and career academies. We had initiated some partnerships with them early on, right before COVID, but some things came to fruition. We were partnered with Bookdale High School to provide education to some of their students towards graduation and really introduce them to the field of behavioral health. So this is really going upstream. I think it has multiple implications in working with this population to reduce the stigma around substance use and mental illness, and also create a career path for these students to recognize behavioral health care as healthcare and really align it with some of the healthcare opportunities that they look at as potential career paths, and knowing that behavioral health care is out there and hopefully get them interested in our field. I can tell you that's one of our biggest struggles is our workforce and making sure we have available workforce to serve the community as it is needed. So that was an exciting opportunity to be able to partner with Akron Public Schools on that. We've worked hard with our local and community statewide partners to make sure that there's PPE available to our service providers. Some of our adult care facilities or our group homes for those with mental health also falls under the purview of Adm Board. So we were really involved in making sure that they had access and weren't on the outskirts of information that was available and had access to the vaccine and PPE as needed. So we really pulled some of those facilities under our umbrella a little more intentionally to make sure that they were getting access and information as needed. And then again, supporting some additional funds to our providers that were engaged in our residential programming and our crisis services, like our psychiatric emergency services, our detox centers, and our residential programs, and working with our most vulnerable, severely mentally ill or severe and persistently mentally ill populations to make sure those services continued, and those that were committed to staying in the community providing those services had the proper protections and knew that they were valued in doing that service to the community.
So Aimee, if I could just interrupt you for 1 second, I regret that we didn't give you quite enough time, but we do stay open for another 10 to 15 minutes. So if I could just pause and adjourn the meeting and take care of the birthday greetings, we'll turn it back over to you. And please, if your schedule allows, we would love to have you stick around for another 10 or 15 minutes.
Absolutely.
Is that okay? All right. So I will reverse my screen to show you our official Rotary Bell that I torture all the people at Akron Children's with and adjourn our meeting. Before I do adjourn, I do want to say happy birthday to Gina Campbell, Anne-Marie O'Brien, and Mario McCall. They'll have a birthday before our next meeting. Our join date celebrations, Dave Coley is 37 years member, Nancy Dodson 4 years, Bill Lowry 5 years, and Jim Durr 5 years. So thank you very much, and we'll chat with you after the bell. Okay, go back. Aimee, I apologize so much.
No worries. I was just a couple slides from being done there and opening it up for conversation. So it wasn't bad at all.
Okay, well, with 2 inductions and everybody was happy today, so I apologize. We like engagement though.
Right, and I'll just throw back up my last slide. So those resources are available to folks who may not have seen those or know that they're out there for resources. We have our crisis text line, our crisis hotline that's 24/7. And again, the addiction helpline that's available for any substance use disorder treatment services and getting streamlined access here in Summit County. So that was pretty much the conclusion of my overview, and I'm open to any questions.
Okay, Lorraine, are you able to stay on to help
Yes.
moderate the chat room?
Absolutely. So there are a couple questions from Dr. Robin here. The first is, why do males get in sooner?
Is that an artifact or was that a numbers thing for suicide services?
Was that for the treatment services,
Yes.
for the residential treatment? Yes, so for residential treatment services, we hold a meeting every other week with our providers to really dig into, any access barriers and trying to understand why the numbers are where they are. And I think one of the things we've determined in terms of males is it's just availability. And it's like, if we have something ready that day or within a couple of days, are you able to get childcare? Are you ready to go right now? Do you have to make arrangements for work and different things? So there are multiple factors that come into play when we're trying to get folks access to services and making sure we're doing everything on our end to try to decrease the barriers that may prevent someone from coming in.
That makes sense.
Another question there is, any services targeted to veterans?
So we serve anyone, especially knowing that many times there are delays in getting into veteran services. So I don't know that we have any specific programs, but if they come to our doorstep, then we're providing those services.
Awesome. Another one is, are there specifically trained APD officers that we should ask for when dealing with ADM related concerns?
Absolutely, absolutely. So we have trained officers in every police department across Summit County, including our hospital systems and the university system that are trained in crisis intervention. So we provide that training at ADM cost for at least 20 officers twice a year. We're trying to increase that to 3 times a year, and we're working with some of our police department partners to make that happen. But if you have someone that is in crisis and you reach out to the police department or 911, you can ask for a CIT officer who has been trained to provide some intervention and hopefully de-escalate the situation in those circumstances.
Awesome.
Aimee, when you were asking, or when somebody asked, I think it was Dr. Rob, asked about the veterans, there is community support services, does have the supportive services for veterans families, as well as the VA has a outreach center right next to CSS's outreach center on Boris Street. So veterans clearly can get access through that, and then they can get referred if they're service-connected disabilities to the VA service. Otherwise, the system will serve, the ADM board system will serve those veterans that are in care. So, and actually the continuum of care that funds the housing program, a lot of housing programs, they actually had a function 0 where they were able to find, and many of those beds were actually funded by the ADM board for veterans to get placed in apartment housing as well. In fact, I think the newest one at Stony Point, there was 6 or 8 apartments strictly funded by the VA for homeless veterans.
And let me tell you, I miss my resident historian, Terry, when he retired from our system. I still can learn so much from him. So thank you so much, Terry.
Sure.
Awesome. Just a lot of positive comments, thank you. Many thanks. That your agency is awesome and it provides amazing services. The other thing is Zach had a question, and he stated that he's interested in the faith-based initiatives. How could he get involved or make that connection there?
Please, by any means, call Adm Board, and I'll put our number in the chat, but it's 330-7, that is my personal number, 330-762-3500, and just reach out and we'll make sure to get you on our email list and get you connected to any way you want to be involved. Like I said, we have a suicide prevention coalition, we have our faith committee, we have our trauma informed care coalition. So we just really try to collaborate with our partners and get the community engaged as much as they want to be helpful.
Very wonderful. So also, you just mentioned a few things, but is there anything else that our club members can do to help, or any other service projects that we might be able to volunteer for?
Yes, absolutely. I would say just visit our website at admboard.org and our community collaborations. And you can always reach out through our website as well to see all the different opportunities that we're involved in with our partners. There's always room for volunteers and different opportunities. They've kind of decreased a little bit due to COVID, but we're trying to build up those opportunities, whether it's virtual or in person as things open up. But we have a lot of virtual meetings and opportunities for the community to get involved.
Awesome. That's so wonderful. You guys do just amazing things. Just another thank you for your services and for your team and the ADM and what you all provide. I'm definitely grateful for that. Does anybody else have any questions, or you can unmute or even put them in the chat?
A quick question. I know my wife teaches high school, and so there's cyclical with teen pregnancy. Is it cyclical with teen suicide and drug abuse as well? Like where you'll have a kid that will have a pregnancy, and then the siblings will not, because they see what their sibling went through. Does the same thing happen through drugs and suicide as well?
Necessarily say it's cyclical, and we really try to watch out for that, because there are such things as contagions, that we watch for when you're having suicides, and really trying to get involved as soon as something happens within the family. Through our coalition, we have outreach and postvention services where there's a team that's activated to go out and support the schools, go out and support the families anytime something like that occurs, to try to put those protective factors so it's not something that's recurrent. Same thing with drug use or overdoses. Our police departments, about 10 of our police departments around the county have quick response teams, and they respond anytime there's a reported overdose to go out to support that family and try to put some resources in place. And to give prevention services in the schools to make sure kids are aware of their vulnerability if there is addiction in the family, and just provide education. So we try to prevent those kind of cyclical occurrences from happening when individual instances occur in families.
Awesome. Just so much wonderful information that you provide. We just want to make sure that, you're always welcome to join us. You're always welcome to come back and just be a part of our club. And we'd just love to have you. Anybody else have any questions or comments?
I would just add, Aimee, that you're more than welcome to play on our icebreakers anytime and give us some tips about what we should really be watching. And like Lorraine said, anytime you have a Tuesday noon free, feel free to drop by. You're always welcome as a guest.
Thank you.
Or as a member in the future. Anybody else have a question for Aimee? Wow, we have two Amies with the same spelling of their first name. That's pretty cool.
Yes, we say that's the correct spelling.
If I had a third daughter, that would have been her name. Spelled that way.
And I like the institution that you have on the file cabinet behind you. I'm an alum.
Great, thank you. Go back, guys.
Yeah, Ohio State, right? Yeah. And thank you. It was a great presentation. I learned a great deal.
Anybody else have anything they'd like to add or questions?
I have a question, and it's whoops, did I see someone's hand up? I don't want to. Oh, it was a thumbs up. when this is completely selfish because I'm a medical professional, but we've learned in the literature that we are the worst at actually getting services or getting care. Much of that is because we're afraid of things being traced or licensure issues. Do you have any insight into that? Is that a subset of your people, or do they just suffer in silence or get private help?
I can say that is a symptom of our folks. And again, even within our system as being healthcare as well, we're really taking a focus on helping the helpers. We all kind of put our head down and just get out here and do the work and do what needs to be done. But I could say some recent work we've been doing with Portage Path Behavioral Health, they have the crisis hotline, and they recently got some additional funding for a warm line, and really targeting healthcare professionals to just, if you need someone to talk to, especially around COVID and the things that we're witnessing and experiencing and the loss that we experience through our clientele and through our personal family experiences. So that's a big marketing campaign that's about to really push out towards our healthcare professional, knowing that that's a resource and it's not attached to insurance or things like that. And this is confidential, so you can call in and get access to that resource just by calling the Portage Path Crisis Hotline that was listed on my PowerPoint. And I'll put that in the chat again too.
I took a picture of your slide. Well, again, we want to thank you for all your good work, and what a nice speaking style you have. I have to comment on that. We get a lot of great speakers with a lot of great content, but you seem like a graduate of Toastmaster. We had a Toastmaster here teaching us about the value of that, and it seems like you could be teaching there.
We did have another question that came in. It's Steve was asking what services are needed more in the county.
Well, I can tell you from sitting in this seat, two things that we're currently working on and looking at is mobile crisis, and that's for both adult and youth. So we have some of our partners that are focusing on youth, but again, we're working with our crisis services to look at crisis. So when our first responders are in the community and they see the need for a counselor or maybe some additional supports from a clinician where they can engage our system and have someone come out, of course, when the environment is safe, but to provide some supports for, some de-escalation or connection to services in the community. So I see that as one of the gaps that we have right now, but we're diligently working in the short term to make that available resource in Summit County.
Awesome. I know I work in the foster care system, so I understand that would be helpful for so many families, especially some of our foster families where our case coordinators might not be able to get there right away, or services immediately that might be necessary. So that's fantastic. Anybody else? We have a few more minutes left.
I had a question, Aimee. I wanted to know, do we have statistics that are separate for girls versus boys? Is there an age-related data that's available that's been collected?
Yes, we do. Absolutely. So again, if you visit admboard.org, all of the data from both the 2013 and the 2018 Youth Risk Behavior Survey is there and available. CASE did a very good job of breaking that down by age groups, by grade levels, by gender, and there's some race data as well. So all of that information is free for public consumption on our website. If you've had any problem finding that, just give us a call and we'll help direct you.
Thank you so much.
Wonderful. Anybody else, anything? Again, thank you, Aimee, for all the information. I think it's so valuable, especially for what we're going through right now, and ways that we are definitely a service-oriented club. Clearly, that's what we are, service above self. So anything that we could do to get involved to help you and our community, will definitely look into what we can do.
Thank you so much, and thank you for having me. Call me anytime.
Thank you, Aimee.
Thank you.
Thank you.
All right, folks, I need to get ready for my next Zoom, so I'm going to step off. And thanks for coming and indulging us and playing along. I've got a lot of good TV shows to waste my time on. All right,
Dr. Rob, real quick. I just want to file a complaint that you put a Pittsburgh Steelers picture right behind the Rotary Bell. I would just like that removed next time.
That's not a Pittsburgh Steeler. That's Troy.
That's my only addition to this.
That's Troy Polamalu, so he doesn't count.
That's presidential rights there, Sam.
That's right.
I'd just like to add one last thing. Jack Ryan is a must-see.
Oh,
That's my
yes.
favorite of ours.
Absolutely. Jack Ryan's a good show.
Absolutely.
Really good show.
I have a list that'll last for another couple of months.
Yeah.
Good.
Thanks.
Thank
And
you.
welcome again, all our guests. Please feel free to come back and join us again. We're pretty much what you see. We're doing the best we can.
Thank you so much. It was really a pleasure to join all of you.
Thank you so much, everybody.
Thank you.
Aimee, this is Jack Herrig. I work with a group called Warriors Journey Home. We work suicide prevention for veterans, as well as healing circles for veterans that are suffering from traumatic injury of the soul and so forth. I'd like to get in touch with you and talk to you about it a little bit. I think we could be a referral for you.
Absolutely, sir. Just give me a call. Whatever is the best way for you to get in touch, you can call that 762-3500 number and they'll get you directly in touch with me.
Great, thank you.
All right, thank you. Look forward to hearing from you.